Hey guys, Luke here from Body Zest, osteopath and practice owner. We are in Banstead, Surrey, which is just underneath London. And we treat people for all sorts of different stuff, but lower back pain and neck pain and stuff like that is really our kind of go-to. Chronic pain in particular. People that have had problems for a long period of time often come and see us because we think of solutions in slightly different ways to other people. Now, I want to talk today about something which I'll cover and package in lots of different ways to talk about, but it's one of the absolute most common questions which we get asked, and common questions which we get asked are the ones that I should be answering for you guys who are watching elsewhere. So a really common question is about rest. Now, when we talk about rest, well, yeah, I guess this video can cover that, can't it? Like, what does rest mean? When is rest the right thing for you? If we're specifically talking about lower back pain, when should you rest versus when should you just get on with it? We're going to cover that today. So yeah, let's get started. So just for a quick definition to start off with then, rest might mean complete immobilization for you. So for some people, rest is like, I'm taking myself off to bed for 1, 2, 3 days. I literally have patients telling me that they do that. And it comes out of a place of fear. It comes out of a place of, my back has gone really badly in the past. And intuitively, I think that if I don't move, it can't go because when it went, I was moving. So people kind of like build this idea in their head that like no movement equals no risk, take myself to bed, and hopefully the storm will weather in the absence of any movement. And by the time I get up again, it's all going to be gone. Rest can also just mean sort of rest from activity, So some people will kind of say, oh yeah, I rested. But really what they mean is, I didn't play golf that day, or, I cancelled tennis, or even I just, did my normal stuff, but there was a box that needed to move and I asked my partner to do it because, I'm resting my back at the moment. So to answer the question of, is rest the right thing for lower back pain? Then we do have to break up lower back pain into a couple of different segments, really. So you've got the lower back pain, which is essentially like a warning sign in the body. Okay, and there's the complexity of the person's history as well, but let's just ignore the history for the time being. Let's assume that you've had back pain in the past, otherwise you're not going to be so paranoid about it. But yeah, we've kind of got like the warning sign lower back pain. So it's like, it's not manifested as anything just yet, but I can feel it and it feels like it might want to go. Then we've kind of got okay, my back is hurting, it's been really aching, and I'm just looking for some symptom relief. And then we've got the full-blown, like, I can't actually move. Now, when we're talking about rest and the application of rest for these 3 different types of lower back pain, for the first one, the warning sign lower back pain, I really, really advise people to consider different solutions other than rest for this, because irregardless of if your back has got a history of going into full-blown spasm even, you do not want to just decondition yourself with huge periods of time of immobilization every time that you feel a twinge, because pain is a normal part of what the body does, and it doesn't always mean that there's even damage there. For you to build strength in the back, it is going to occasionally hurt, but then for it to hurt and for you to have the mindset of, oh my God, it hurts, I need to rest, and then you take yourself off to bed for 3 days, this just isn't good for you. So I would say for the patient like that, what we really want to be doing is saying that we have a list of safe and effective movement-based exercises that are your go-to in that situation. I feel like it's twinging, I feel like it might go. Right, I remember what Luke gave me. I'm going to do the one against the wall. I'm going to do the one laying on my back. I'm going to move it gently, engage the muscles, stimulate the nerves, get some blood flow to the area, but I'm not just going to stop. The second situation of lower back pain, where it is hurting and you're kind of like, okay, this is getting uncomfortable now, then rest is okay, but complete immobilization again is like something that you should really be considering, like, is this the right thing for me or not? So if your back is hurting, you've been on your feet all day, you've been standing at some sort of, I don't know, seminar or on the tube or whatever, in a nasty seat that you're not used to and it hurts, then it's like, okay, like the first thing to be doing here is thinking, can I resolve this with some movement? But that doesn't have to be hard work or anything like that. So you could essentially be resting, but just with some gentle movement. And then you want to be thinking about, okay, if I do rest my back in this situation, can I actually just do it for a shorter amount of time than I usually do? Can I just say, okay, I'm going to take a break for an hour or two, and then I'm going to get up and then I'm going to have a move around and see if I can loosen this off? Because what we don't want is for you to aggravate your back with a load of standing and then just sit or lay down for ages expecting that to resolve it. But actually all of that tension that's kind of built up and possibly that inflammation that's built up now just has nowhere to go because you're not getting things moving. So I'd still always be saying to opt on the side of trying to do more instead of trying to do less in that situation. Lastly then, with the fully acute, okay, it's gone, and I'm in real trouble here, then yes, rest is okay. Again, consider how long you're resting for. Don't make any assumptions about what is absolutely required. If your back goes into an acute spasm, and you literally can't stand up, you can't get in just get yourself into a comfortable position. I'm going to advocate for that all the time. Get yourself comfortable, chill out, take some deep breaths. And we're going to see how long this storm is likely to, be coming through for. After an hour, a couple of hours or something like that, try and get it moving a little bit. If you're laying down, lift up your knees. Can you do it? Can you let them go from side to side? If it's a yes, can you try a little bit more? Can you lift the leg up? Not big, gross, angry movements that are potentially just going to, put you in searing pain again. But you need to start to know, like, can this move? Can this be stimulated? Because the actual recovery is going to come from movement. The pain might be reduced from laying there for a bit, but it's not going to solve the problem. The solving of the problem is going to come, basically, if your back is in a spasm, from that messaging signal from the brain eventually going. And the messaging signal that is going to the muscle and telling it to spasm, going away, is going to come from your brain getting confident that you can do these movements in a safe way. And that is going to come from stimulating the muscles and actually doing the movements in a safe way. So yes, rest and chill and, do whatever you need to do in the short term, but don't wait forever to start to try to see if you can actually build a little bit of movement into it. Cool, guys, that's just kind of like me spitballing a little bit, but that is the advice that I would give to my patients about when they should rest. And yeah, basically motion is lotion. Always be thinking, can I do more instead of do less? And that's generally going to stand by you better than just always opting for rest all the time. Now, if we're talking about rest from a certain activity, that is slightly different. So there are certain conditions where we would of course be like, yeah, you know what, that particular activity aggravates it. Now, you can kind of use rest like a painkiller almost. You can sort of say like, okay, this isn't going to solve the problem, but I'm uncomfortable, like we said in the kind of like the second example of the person in pain. I'm a bit uncomfortable, so I want to be in less pain. This is a short-term thing potentially. So do I want to play golf today? Maybe not, because I know it's probably going to make it worse. So rest from an activity, but then continuing to move around is actually fine if that's something intuitively that you should do. So really be, this is now bespoke to the person and to the activity. It's like if you know that the activity that you enjoy is just the walk, and it's not going to load your back, and you're like, oh, should I, shouldn't I? Then it's like, you probably just should, like, think about what it's doing to your back. Not much, it's just getting you moving, it's gentle, you may as well just crack on with it. If it is golf or tennis, and you know that there's going to be an expectation, there's other people involved, there's other players, there's an expectation that you're going to see something through. You're not going to be able to be in tune with your body in the right way. You're not going to be able to make the right decision for your back at that time. You're going to be making decisions based on trying to please the other players. If you're on a 4-ball and you're teeing off and you're on the 7th and it's really hurting, oh God, I can't let everyone down, I've got to carry on. That's the problem, or you start a game of tennis with someone and 5 games in and you think, oh God, this really is hurting, but this person has, driven half an hour to get here. That's a problem. Don't take on things that are potentially going to risk making the pain worse if you feel like you're not going to be able to really listen to your body and just do the right things. But if it's just something gentle and it's a walk and you know that you can stay really present and keep movement, but keep it in quite a controlled way, then I would say you don't need to rest from that activity, just carry on. But the big higher risk out of your control ones, then it probably is smart to rest from those if your back is feeling really bad. Cool, right, hope that helps. A little bit on rest. Yeah, have a look through the channel. There's lots of helpful videos like this, I promise.